Hi guys, it's Dr. Dianni here. So in today's video, I'm going to answer some of the most googled questions about Botox. What is Botox used for? So botulinum toxin type A works on the neuromuscular junction. What it does is it actually blocks nerve signals from reaching the muscles. Therefore, if the muscles are not getting nerve signals, they won't contract as forcefully and properly. Therefore, when we inject Botox into certain areas of the face, this will relax the muscles and help reduce lines and wrinkles. How long does Botox last? And this will obviously depend on the amount we inject and where it's been placed in the face or in the body. But as a rule of thumb, botulinum toxins typically last between 3 to 6 months. Another commonly asked question is, can you stop Botox once you start? Of course, that's your choice, and of course you can stop Botox and decide that you don't want any further treatments. It's definitely a myth. People say that once you start Botox or derma fillers, you have to be doing them for life. I think most people do choose to keep doing them because they really like the results and they see the benefits of having these treatments in terms of anti-aging. But if you stop the treatments at any point, what will happen is your muscles or whatever, your soft tissues will just return to their baseline without getting worse. Are fillers better than Botox? Actually, a lot of people are confused about Botox and fillers and the differences between Botox and fillers. They are entirely different. Although both Botox and fillers are used to get rid of wrinkles, they work by completely different mechanisms. Botox works by relaxing the muscles. When the muscles are relaxed, they will stop creasing the skin, therefore you'll get fewer wrinkles that way. Fillers are directly injected into wrinkles to smoothen out the wrinkles, and they are typically made up of hyaluronic acid. Another question is, does Botox look weird at first? Again, this shouldn't happen if you go to a very experienced doctor for the treatment. The Botox should kick in nicely, and the results that you will get after 2 weeks should be exactly what you expect. So the results shouldn't be too frozen or too natural. It should be the right balance, and it shouldn't look weird. Can you tell if someone has had Botox done? Okay, this is a tricky question because one, if somebody's had Botox and had a bit too much, they kind of appear frozen, and usually that's when people notice they've had something done. Another scenario is when a side effect or complication occurs, such as brow ptosis or eyelid ptosis, where the brows drop, where the eyelids drop, or where one side of the face is a little bit uneven compared to the other side. In these situations, obviously, people may notice that someone's had Botox done, but Botox can be done very naturally and can be quite unnoticeable, really. So do Botox injections hurt? We do apply numbing cream typically before we inject, and that typically really helps with any pain or discomfort. The needle I use to inject Botox is usually very, very fine, so between 30 to 32 gauge. That's the same needle diabetic patients use to administer insulin to themselves. So really fine needle. So to answer the question, I personally don't find Botox painful at all. Occasionally some people obviously who are more sensitive to pain can find it a little bit uncomfortable, but overall the pain level is really minor. So in summary, Botox can be used for many different indications, starting from the simple anti-wrinkle in the forehead, in the frown, in the crow's feet, to more specialized indications such as excessive sweating, shoulder slimming, leg slimming, jaw slimming, etc. If you're interested in having Botox done but you're not sure about it, we welcome you to have a consultation with us. I am in clinic every Wednesday and Thursday. Alternatively, you can get in touch with both like clinic and we can do a virtual consultation regarding Botox as well.